Good morning, everyone. It is 9 o'clock. I am Paula Hodek. I chair the county committee here. I'd like to call to order the Price County Health and Human Services Board. At this time, if we could have roll, Meredith, please.
Good morning.
Good morning.
Joe Baratka.
Here.
Paula Hodek.
Here.
Robert Kopish. Patricia Stephen. Here. Dennis Worko.
Here.
Nicole Kowicki, are you online? *6 if you are online, Nicole Kowicki. Sally Hummel. Suzanne Acker. And Gerald Swenson is excused.
And he is excused.
Yes.
Okay, well, welcome, everyone. And right now, let's just move right on to the public comment. Is there anyone? I see no one in the gallery. Anyone online? Nick?
I mean, there's people online, but
Nobody's
for public,
stuck. No, oh, thank you for checking. Thank you. Okay, then let's move on. Hearing and seeing none for public comment. Let's move on to communications from anyone on the board here. Any concerns, comments? Okay. Hearing and seeing none, we'll move on then. Vouchers are, do I have them? I do, right in front of me. We'll get those going and then we'll come back to those. Sorry, we had a lot of things going here. So the minutes from the April 8th meeting, what is your pleasure?
you're not gonna do vouchers. That's
Well, I said we'll come back to them. I'm going to sign them. Let's go to the minutes from the April 8th meeting. What is your pleasure? Anyone on the board here would like to?
I'll move to approve. I'll
Was that-
second that.
Was that you, Mr. Kopish? Okay, Mr. Kopish.
Was this on? Can you hear me? Is it on?
you're good.
It is now, yeah. And second from Mr. Baratka. Any concerns or comments? Any discussion? All right, if not, I'll call for the vote. All those in favor?
Aye.
Those opposed? Okay, those are passed. Let's see. So we have to go back to our February 11th meeting minutes. There was just a little glitch in Ms. Kolwicki was marked that she was at the meeting and she was not. She was excused at that time. So we're making that change to the minutes to have them amended. So I need a motion for that amendment, please.
So move.
Okay, Mr. Wardco,
I'll second.
Mr. Kopesh, seconds. Any discussion? Hearing and seeing none. Call for the vote. All those in favor?
Aye.
Those opposed? All right, that's passed as well. And let's move on to, I will sign this and move this on to the board members here. Aging and Disability and Senior Citizens Unit. Public Health on number 5, I'm not skipping it on purpose. Tiffany has nothing to report at this time. So she was not available. Aging and Disability, Senior Services Unit, Chris Mabey and Chris. Good morning. Please.
All right. So good morning, everyone.
Your microphone is not on,
But it's on. Hello.
but you have to eat the microphone.
Okay. Can you hear me now? So the Nutrition Advisory Council meeting was held on April 23rd in Brentwood. This was the last meeting for Bill Hoffman and Rita Wenzel as their terms were up. So Dave Schmidt will represent Park Falls now, and Robin Nielsen will represent the Brentwood site. We reviewed the contribution confidentiality policy. We reviewed meal comments that were received during the last 3 months. Most of the comments received were from the home delivered participants. We did get others from the Rate Your Plates, which are filled out at the dining sites. The March meal site stats were reviewed. We served 1,702 meals in March. The report also shows contributions collected from each site too. So a flow chart was prepared by Carrie that demonstrated what the average cost of the meal was for 2025. The average cost was $18.94 per meal. The site reports were given. Brentwood reported that the last 3 months have generally been, have had good meals. Ogama said they were happy with the meals. A few Taylor County residents have been attending the site. Park Falls, the congregate numbers are down from what they had been, but they were very satisfied with the meals. Phillips, the site manager, would like to see other diabetic desserts offered than the vanilla snap cookies, but the participants had no complaints. So overall, all of those sites were happy with the meals. Kennan expressed numerous concerns, including their dislike of tropical fruit. They would like to see more parsley added to the parsley buttered potatoes. They would like to see leaf lettuce instead of shredded. They want the eggs removed from the potato salad. They would like the coleslaw cut up smaller. The pork is dry. The pears are hard. They were disappointed with the pies they received for volunteer appreciation, but they do like the soups. Questions?
Madam Chair, may I ask a question?
Mr. Ernst, yes.
I'm just curious, how do you determine the cost of a meal? I mean, what's factored in there beside, the cost at the restaurant is like $5 and some change, I think?
Yep. So numerous factors are taken in. What it costs to deliver the meals to each of the sites, what we pay the Red Apple, the site supplies, rent, what we pay for rent. So it's all those are calculated into the cost per day.
So you add all those together and divide by the number of meals served? Basically?
Yeah.
Well, it's more than 3 times what we're paying for the actual food then.
Right. So yeah, it does cost way more to have a meal, what we pay than what we pay the cafe. Because
I'm not
there's a lot of
questioning, I'm just
factors.
curious.
Yeah.
Thank you.
Ms. Stephen?
I'm just wondering if we gave out that survey on April 1st,
Right?
and they were very creative.
That's your usual complaints down there, so. All right. So the COA Council on Aging meeting was held on April 13th at the normal building. Bylaws were approved. I updated the Council on Aging on the nutrition program end of year review that was completed by GWAR. They had requested temperature logs from each site, plated food pictures, home delivered temp logs, and meals. It's always a work in progress to keep the meal temps where they should be when the meals are delivered. Hot foods need to be received in and delivered at 135 or hotter. Colds need to be at 41 degrees or colder. A reminder to site managers to complete the temp log in full. Some days it was noted that only 2 fruits and vegetables are being served. There needs to be a total of 3 fruit and vegetable servings or an increase in the serving size. This has been brought to both the Phillips Cafe and the dietitian's attention. We reviewed the Nutrition Advisory Committee meeting information that occurred in Brentwood. We had our volunteer driver luncheon on April 21st. It was held at Marie's on Fayette. We recognized our volunteer drivers for both the elderly and disabled transportation programs, as well as our home delivered meal drivers. As part of the Volunteer Appreciation Month, we also delivered a sweet treat to the dining sites. Mind Over Matter, Healthy Bowels, Healthy Bladder class was held at Aspira Stubroy in January. There was also one held at the Peace Center in Park Falls. Art students from Phillips made Valentines for the home delivered meal participants. A rep from NTC has scheduled numerous visits to the Ogama, Brentwood, and Kennan sites to help with technology. Senior Services and the ADRC have been doing community outreach. We visited Pine Village and Prentice, Lake Village, in Phillips and Charlesville Villa and Flambeau Heights in Park Falls. The Senior Services Nutrition Program, that's going to be coming up soon. Counties did see a decrease in the number of booklets they're receiving this year. Price County will receive 106 books. Talked about the Senior Living Expo, which will be held on October 6th. Our volunteer drivers, we did 92 trips in January through March with 10,120 miles. Carrie was in attendance for the meeting and went over the flow chart for the nutrition program.
Nice.
A suggestion was made to provide outreach at the voting sites, and our next meeting will be June 8th in Ogama. Any questions?
Okay, we'll move on to the Senior Services Quarterly Report. You have a packet in your packet.
Nutrition for home delivered meals. We served 70 people with 2,833 meals. Congregate 132 people, 1,552 meals. Transportation for those 3 months. Again, we drove 10,120 miles. They volunteered 354 and a half hours of their time, and we had 4 volunteer drivers during that time. Again, I talked about the volunteer appreciation. Just a little stat, in 2025, between 7 drivers, they drove a total of 27,712 miles for medical appointments and shopping, and volunteered 922 hours. Strong Bodies, the winter session was held January 5th through March 15th. Mind Over Matter workshop was held with about 10 participants over at Duroy, and 5 attended at the Peace Center in Park Falls. In January, Deb Richter and Birch Street Funeral Service spoke at Park Falls site with about 8 attendees. February, Spear Law Office visited the Phillips site with about 6 attendees. In March, Technology Assistance was at Brentwood site. Bingo at the Phillips site with the Red Apple. Folks were invited, or they joined in as well, with about 12 of them. And then Cheyenne did a pressed flower craft at Brentwood, Kennon, and Ogama. And that's about it.
Number 6. Any questions for Chris? Oh, thank you very much.
Thank you.
So we're going to go back up to the vouchers. I believe they've gone through. We need a motion and a second before we can have any discussion to approve.
I'd make a motion to approve.
Okay. Mr. Baratka, I need a second.
A second.
Okay, Mr. Kopish. Now open to discussion. Mr. Kopish,
I do have a question.
I know you do.
You do?
I do.
Well, first of all, you can see Chrisanna's well rested. I sent her my email on Monday, so she had
That's
Tuesday to,
very
instead of in
nice
the
of
middle
you.
of the night on Tuesday night, so she's well rested. But I handed out a sheet. You all got this? That's my question's gonna have to do with this sheet. And basically what I'm asking you to do is take these totals and connect them with the services that we're providing with that money, like the first one there, kinship care, who's getting that money, and then substitute care, who's getting that money, just
Okay.
the group of people that are getting paid.
So kinship care are the children placed with relatives, so kin. So these people have some relationship with maybe it's a grandchild, niece, nephew, but they're being placed with a relative. So it's a little bit cheaper rate. It's a monthly rate that we pay them, not a daily. So they're just placed locally with someone that they're related to.
And is that the total for the month, or is there another batch?
Nope, that was the total
Okay,
for
so we spent
March.
$2,031 on that issue.
Correct.
Okay.
The substitute care is just our regular foster care parents. and there's a daily rate, based on their needs. So that's strictly foster parents that are licensed.
And that's also the total for the month.
Correct.
Okay, so we can see that that's what we're paying for the foster care.
Mhm.
Okay,
Treatment foster care, that is called a treatment level foster care agency. And we pay them an administrative rate to supervise or oversee the case that's not in Price County.
Okay.
And then we still pay the foster parents. This is just an administrative fee that we pay.
so that's a flat thing we pay every couple of weeks or so?
That's, excuse me, again, monthly based on where they're
Okay.
placed.
Okay.
We get a bill from that
Right.
agency. Secure detention, just a locked facility for juveniles. And this is the first one we've had since 2022, I think.
Yes.
Okay. And then the youth aids, or the last one, youth aids. Those are our group homes and residential care centers, which are, as you can see, more expensive than the other ones.
So which are those last two categories are the ones we see on our high cost placements? Oh, no, the last two categories, which is the secure detention and the youth aids, is that what we see on here? The last two of them? Okay, all right, because that adds up to what, 67,000 roughly? And I think that's probably pretty consistent. What is it?
66,230.
Oh, and the 1,200.
Right. From there, right, with detention.
I was just thinking one group ago.
Okay,
And usually those secure detention ones are not real long of period. It's generally a short amount of time.
are those all individual ones?
This was, yes.
Yeah,
It was
these are
just
all
one facility
individuals.
for
So
one
these are all
client.
individual costs. So there's somebody that we're paying $21,000 and somebody for
Correct.
$19,000. Okay.
Correct.
All right. A lot of money. Yeah, thank you.
You're welcome.
Are
Anything
there any
else?
other questions for Chrisanne from the board?
Only clarifying on that, could it be like they go from the Fond du Lac so not each line is an individual person, because you could have somebody in the Fond du Lac one for 8 days or
You could,
short
yep.
term, and then they go into Prentice House, so it would be the same person, two different lines. So just so people don't think we have 7 or 6, but it
Mhm.
could be one less, or
Depending when
close.
the placement changes.
it is individuals, but they could go from one
Right.
facility to the next depending on the level of care needed in the middle of a month.
And
So,
sometimes like Prentice House, we could have two different clients there, so that would reflect
yeah.
that. But right now, I believe it's only one. So.
I kind of want to go back to our foster care placements as well, is a relative can become a foster parent, so they will receive that. So we don't have all these, if you see that, these are not all foster parents. They have gotten licensed as foster care for their grandchild or for their niece or for their nephew.
Sorry,
or-
I missed that. Yeah.
Okay, Mr. Baratka?
Thank you, Madam Chair.
Mhm.
So with that high cost placement, is that all local levy dollars, or is there some state funding involved with that, or how does that relate in the budget?
These accounts are coming out of grants from the state. We report to the state and get a reimbursement for.
Thank you.
Yeah, something to say so.
Right.
I was going to say a lot of it, some of it's
There's-
youth aids.
It's a ratio kind of, so the state, it's a mandated service. The state gives a level, and then everything above that level we do. So if you look at the cost to high cost placements, it's not cash in, cash out, but a percentage of that is levy dollars. So that's usually where the department goes over levy, is with those high cost placements.
Right, is that percentage
I
50?
couldn't even
I
tell
mean,
you.
okay.
What would you guess, Carrie?
Some of the stuff that it goes into, a whole bunch of stuff goes into it, so it's kind of hard to say it exactly, because like lots of expenses into that pot.
Yeah.
Including
And-
wages and wages for staff and stuff also go into that youth aids categories.
All right, thank you.
Okay, to follow up on Joe's question, what, this is net levy, isn't it? Is this offset by revenue? This is the high cost placement report.
Right?
I'd have,
I just always thought this was net levy.
in the end, you could look at it that way. See, that's where it's hard because, like we just said, the wages go in there, your cost of your office, your PARS report, everything goes into all kinds of stuff that gets you the revenue back. So it's the total cost of doing business. Those are the costs of going to those programs. So I couldn't tell you what percentage.
But there is a revenue offset to this then,
some,
from what I'm hearing.
a slight.
Oh.
It's not proportional to the expense. So if the expense is
No,
a million, it's
but
not like
is
you
it
get
10% of this number or 50%?
this year. It could be 10%. The higher the number goes, the less the percentage is.
Oh, because
So-
it's a fixed amount?
Right. So you get a cap on what the state's willing to cover in some programs. Some programs go above that. Like, so we sign contracts every year saying your share of X program is 700,000. Your share of this program is 200,000. So when Chrisanne's doing her stuff, she's split 23, 23, 23, 10, 5, 7 to all these programs. If we can keep those programs under that level, it's 100% covered. But then when you get a high cost placement that's $1 million, well, now you only get 10% reimbursement on the total because the offset's way beyond. It's not a percentage offset, it's a total yearly offset. So we know our revenues, our goal is to not go above the revenues, but you have a high cost placement, so your percentage changes every year.
This is cost. It's not net,
Cost of the high
not
cost.
net
Correct.
cost impact or
That's,
net impact.
that's how I would look at
Okay,
it.
all
yes.
Madam Chair, one more question.
One more question, Mr. Bronca?
So, and the reason I asked that question is to know what our percentage or what we're getting from the state. These are mandated, required things we have to do. Not that we wouldn't take care of our youth if it wasn't mandated. But if it is, if we can get an idea of what that is and have that conversation, obviously may not go anywhere with the state officials, but if you don't have the conversation, you don't know. So I guess the point I'm making is if we can find that out, that we can have those conversations with our representatives. Obviously, this problem isn't going away.
Yeah, so
and it's gonna
we
get worse. So
we do that. We've done that with WCA quite a bit, where they've requested, okay, tell us all your mental health. We've done that. Was the behavioral health was the program that we really focused on over the last 2 to 5 years. And we went to the state and said, okay, this year we had $1 million and the state gave us 400,000. And so we have seen an increase in CCS, CST, all the mental health program funding from the state. So that's where we're seeing more increase. If I had to guess in general, when we do like wages, we look at like over there's some wages that get covered 100% and some get covered 20%. But in general, what the state gives us towards those mandated would be between that 60 and 70%. So you would have to have a perfect year with nobody in a high cost placement, nothing where you could say, oh, look, the state paid for the mandated service. So we are discussing that with the state yearly.
Yeah.
That is a yearly request, and that where we saw some big movement on the mental health, the
Right.
behavioral health.
And I don't take that I was saying that we as a county weren't doing that. But when I'm talking with people in the community, so a good case of that is the Highway 70 thing that happened up there, and they weren't going to do anything with it. And then all of a sudden, people started talking. This is where I'm getting with it. When it affects the local economy to a point that the taxpayers start getting involved, that's where I'm at with this, is that if I'm talking to people in the community, say, well, our taxes are high. Well, here's a mandated thing that we have to do, and here's what we're getting from the state. Have the conversation. So
Good call.
so I just wanted
Yeah,
to make
no.
sure you weren't thinking I was saying that you guys weren't doing what you needed to do to try to allocate more funds. So.
Where we're seeing a lot more pressure. So some of our surrounding counties have had $1 million cases a couple times. And so they've really pushed the state to say something, we need to be addressing this. Well, now we're seeing Brown County, Dodge County, some of the bigger ones seeing these $1 million cases, but they already had $1 million covered. They're seeing 3 of them, 4 of them, 5 of them. So we're seeing more discussion on it, where the struggle is the state's never going to change to say, oh, like winter maintenance, right? Oh, it's our road or our maintenance state, you went over, here's the checkbook, here you go. what the state's afraid of with this high cost placement issue is we go and say, we had to set aside a minimum or whatever the state was giving us. Hey, state, we went over by 300,000, open that checkbook, tell us, it's a mandated service. What the state, from what I understand from the discussions we've had, is their fear would be and I disagree 100%, that our employees would stop doing the best they could and just go place them.
No.
It's the state's going to pay for it. It's not our problem. I don't agree with that statement, but that's the thought process is, well, we have to keep these limits so that they work really hard to not place these people and not go to the high cost level. So that's what we're battling against, is they're not going to give you an open checkbook. They're not going to. So what rails can they put in to say, we know there's a cost and it's getting worse and the facilities are closing or they're not available or they're overrun, as in too many individuals. How do we get past that? And the state, and I don't know where we're at, Sarah might know more, like they've tried to create facilities for youth and the state said, okay, we'll pay for the facility. And those counties said, okay, we're interested. We could see sponsoring a facility and we'll do the work, but you got to pay us. And then the state said, but if you go over the amount we've agreed upon, the county is responsible for. Well, the county's like, whoa, what if we go over by $1 million? We don't have a levy of $1 million to be doing this. So it stopped a lot of that. I think only one ended up moving forward, if I'm right. 1 or 2 out of the 8, I think they were trying to build. So I don't know if you know a little bit more. So.
Yeah, well, I
Thanks.
mean, there's not very many facilities.
Right.
And I think some months in years past, we've been over $100,000 for 1 month of cost for between foster care, group home, all that. And then even the last couple of years, it had been down quite a bit until we started getting a couple of kids in those placements, and they're sky high. So it just totally depends on the year, the month, whatever. So
It is a priority of WCA, WCEA, which is our administrator group, that we are working towards a solution because we're not the only county. We, knock on wood, we've been managing it well. We had some rough years, but we're kind of back to what, if you just looked at a slope of what the cost, the average would be. But some of our partner counties are seeing 2, 3, 4 high cost placements that are high,
Breaking
not
the
just
bank.
their average. So.
Well, good discussion here. Anything else for Chrisanne? Okay, let's go back. I'm going to call the vote. All those in favor for the vouchers?
Aye.
Those opposed? Okay, vouchers carry. Who has the copy so that Chrisanne you have them already? Okay. Thanks for waiting for us. Okay, have a great day. All right, let's move on down, and we are now at Behavioral Health Unit. Are you covering that?
Children and youth.
Oh, Children and Youth. Oh, you're right, Children and Youth. I don't see Kayla here. You must be covering. Okay.
What we just have here is the juvenile offenders annual report that we've handed out. It gives the demographics. We've done this for the past 35 years, I believe. So if you have any questions, you can just look through it. One thing that I do want to say is up on top where it says where the number of referrals, where we're down. Obviously we're down, but the complexity of the cases are pretty significant. So I just kind of want to let you know that a lot of the mental health issues that we've talked about in the past. I mean, I don't need to go through this.
I'll give them a few seconds to look through.
Detentions are down, delinquencies are down. What do you attribute that to? What's changed?
The mental health is more severe. Delinquencies, it's any kind of given year. There's no pinpoint because it could change today. Maybe with law enforcement, being out and more citations. But yeah, see any pinpointing of anything. It can change anytime. And then also I want to say is maybe the kids are on computers on, not out and about.
Yeah.
Yeah.
Madam Chair, if I may.
I'm sorry. Yes, Mr. Baratka.
So just looking from these offenses, from 2018 to 25, it looks like across the board, there's a drop in the amount of offenses. Am I reading this table correctly?
Yes. Yeah.
So almost everything has come down. Maybe part of attributing that to could be, the education side of it. So I know our, obviously Health and Human Services, all of you down there, county nurse, you've done a lot of proactive things in the past few years. I would attribute some of that to that. Do you kind of think that might be a part of it too,
Def-
education?
That's definitely.
Okay, thank you.
Or less kids.
Mhm.
That could be less kids too. Yeah, I think it's a combination of everything maybe.
Yeah.
So, thank you.
That's as well, being involved with schools and our new programs, our CST programs, our CCS programs and public health, what they've been out there with the younger kids. And so.
Is everyone okay that we move on? You can always put questions down and come back or call Sarah or call Kayla and they can give you a answer if you need. So let's move on to our behavioral health unit, and that would be Chana. She's not here, so I'm guessing you're.
Actually, I just kind of wanted to let you know is that Jennifer and I have been working on the job description. It's updated now, so we will be getting that out for advertising for that position.
All right, let's move on to number 9. I see Beth is here. So Beth, if you want to come on up. This is for economic support. Good morning. You have to pull that a little closer to you. There you go.
Okay, so I'm going to go over our quarterly estimates because I was not able to make it last month. So the Price County Food Share cases are 1,032 with 1,793 participants. $240,408.67 in benefits were issued during the first quarter. We have a total of 2,420 MA cases with 3,778 recipients. And then to further break that down, 1,199 are Badger Care cases with 2,380 recipients. 240 elderly, blind, and disabled cases with 242 participants. The MAP program is 158 cases with 169 participants. The MAP program does require the participants to pay a monthly premium. And then the Medicaid Savings Program, we had 409 cases with 424 participants, and that is the program that pays the Medicare Part B premium. Long-term care cases would be our nursing home or in-home care cases, 134 cases with 138 participants. Our other IM or caretaker supplement cases were 265 with 414 participants. Caretaker supplement is where a disabled parent can receive a cash payment for each child that they have. Childcare, we had 6 cases with 9 children, $4,433.20. Our childcare cases are pretty low, but we do have to have certified childcare facilities in order to qualify for that program, and we do not have very many in Price County. So then on the right-hand side is the whole consortium estimates if you want to look at those numbers on your own. And then I also want to go over the fraud statistics. And this is for our whole consortium. We don't break it down by county, unfortunately. But we have 965 backlogged cases right now. We had 244 new overpayment renewals since the beginning of the year. And we have completed 42. They are very time consuming. We have 200 backlogged CSI investigation referrals, and that is where we hire an investigator to go out and research if there really is fraud going on. We're limited on the number of them that we can do because it is funding and we only have so much in the budget. 20 new referrals this year and 14 have been completed so far in the first quarter. Again, those numbers are low because we just don't have the money to investigate everyone. And Zwica discrepancies completed were 70, and that is where the wages that the customer reports to us does not match the system that the employer reports to the state. Our systems are kind of linked, so we get a discrepancy that we have to follow up on and determine if the client went over their reporting requirements. So far, $139,719 in fraud overpayment claims have been completed, meaning there are repayment plans in effect and those are slowly getting repaid. Zwica discrepancies, we were $102,033. And then we've had $24,745 in agency error claims. Unfortunately, you know, our workers are not perfect and we do make errors. The clients all receive notices. When we make updates to their case, it is their responsibility to review them. And if something's not correct, they're supposed to call us and let us know. So sometimes it goes undetected for quite a while and they do have to repay them.
Any questions? Mr. Kopish?
One. What's in this column versus this column?
The right column,
Mhm.
Yeah,
this is the whole consortium for the first quarter.
and that's how many counties?
Is it 10 now or 11? Because we got Forest left us at the beginning of the year, so it's one less than we've had.
10? This is 10 counties, same period, it's just 10 counties.
Correct.
All right. Huh?
Yeah, they're not.
I would say it's not 10 like-sized counties, so you can't say like, we should
No.
be 1/10 of it, because is it Wood
No.
counties in there,
Right.
which is a very
Yeah.
populated versus what we are.
Right.
Are there any other questions for Beth?
Madam Chair,
Yes, Mr. Brodka.
just a quick question on the overpayment claims. So when there's found that there is overpayment and they're paying that back, where does that funding go into? So where does it go back to program? Does the county get some of it? I guess where does it, or the consortium get it, or where does it go to?
I believe it goes back to the consortium.
Okay, all right.
At one point, the county got a percentage of it, but that is no longer the case.
I was just looking at your number of backlog cases and the amount that overpayment claims are in dollars. I would think there should be a conversation to get more investigators to pay for themselves and then some. So just a thought. Thank you.
Yeah.
No.
I hear it, but it is tax dollars all the way across. So just a thought.
Okay, any other questions? If not, thank you, Beth. Thank you very much. All right, Carrie Hammond for our fiscal and administrative unit.
Okay, well, good morning.
Good morning.
You had started to ask some questions about this report prior, but can see too, as Sarah did kind of mention too, about the behavioral health. That one has seen a decrease too from 2024 to 2025.
And some of that I think could also be contributed to the CCS program, where we have seen a huge increase in that program, and that is a little bit more of a preventative program to keep clients out of maybe a high cost placement area. I will say that the behavioral health too is a little similar to the CNY of that discussion, where there are some revenues that we do get back for this. I can kind of maybe try to streamline something that would be about as clear as mud for you next time, where you could kind of maybe see where some of these sources are coming from. I do think essentially though too, there are some areas where we can pull out certain grants, but almost ultimately kind of looking at the year-end revenue to expenses might just kind of give you a little bit better of idea. But I see Nick's pressing his button.
No, I was I was just thinking about the conversation and then these charts. Like, it's the chart we've always used, right? We've said these 5 line items where we charge most likely the high cost placements, the out of house placements. That really doesn't represent anymore the true cost of doing something. So like behavioral health, out of the placements are going down, but doesn't mean we're not investing in the programming, and the smaller costs have gone up, but we also get those costs covered in more of a, hey, we're preventative. We're doing the stuff that stops it from getting to what this chart would be. So I don't know. I don't want people to misunderstand that, like, oh, costs are going down in behavioral health on this chart, to we're still seeing a behavioral health cost program issue in what's happening in the community, right? We're still needing the programming and the money to do this stuff. It's just not getting to the high cost, which those are when all of a sudden you start going way over budget because the state only pays so much. So it might be something we all get together and just say, okay, what's a better representation of what's happening to and what it's costing levy wise, rather than the cost, because it was a good indicator for a long time because we weren't getting funding from the state, but now that's changing, or we're getting more of that middle programming, which we've talked about for years, is really, really helpful. So we'll think about that.
I'm not sure if this is going to make sense or not either, but I know that in juvenile justice at times we've had programs for the juveniles and we had brought down the cost. So then all of a sudden the state saw that, and so then they take away money from us because we're doing a good job and money that we have done, and that gets extremely frustrating, so that we can't continue to do those programs.
I think the most successful program we discussed was we would get like this $40,000-ish a year to help people stay, or help kids stay in a household, and it went towards like fixing somebody's flat tire so that the parent could get to work or get the kids to the school or wherever, like just little things that everyday people may not think about as the friction to maintain a household. We talked about a washer and dryer, I think was one of our,
For the
or a
TSA.
washer or dryer, one of the two broke in a household. It was causing them issues because they couldn't get to a laundromat and still maintain the household. And the kids then were starting to struggle at school because their clothing wasn't, all these things. And it was like $400, right, out of this big thing, which prevented them having to be taken from the home to go to a foster situation. Like, it's such a little amount of money in the state. Those are the programs we're talking about, where the state will put aside a small amount of money that works, and then they go, oh, look, your costs are going way down. We don't need to do this $400,000 or $40,000 program. And all of a sudden we go the other way because we don't have that money to do the programming.
Okay. Any other questions?
You want to talk about your audit coming up?
We just have our audit starting next week.
Yeah. So for those who are not familiar, every year we're audited on where we spend our money and how we spend the money and what programs, and are we following all our grants properly. There's levels, so anything over X dollars has to be looked at. So we've done our field audit, which is the whole county. And was it next week? In the next 2 weeks?
Yep, next week.
They'll be,
Reese.
well, we'll do it online, but they'll be doing what's called a single audit, which is they choose all of our federal or look at all of our federal state grants. They pick anything over, I think it's 300,000, 250. There's this threshold that has to be looked at. And then beyond that, you have to cover at least X% of your total grant. So say we get $1 million and we only have one that's 250 or 300 that's guaranteed. They have to find 200,000 more dollars worth of grants to be checking. So then they randomly pick until they hit to that number. Numbers are much bigger than that or more than that. But so they'll do the single audit. So that includes also any bridge stuff we have for the snowmobile, ATV club, land conservation, everything in Health and Human Services. So that's about a week-long audit. It's called a single audit. They compare, and then what they'll do is they pull the grant and says, okay, here's all the requirements of the grant. Did they meet them? Did they do the filing requirement? Do they do the reporting properly? And then we get a report saying, previously we've always gotten, well done. You know, we've had one like, oh, you missed a invoice. It needs to be stamped with a date or something. But in general, they are very meticulous on, they pick a grant, they go through, they randomly check how it's spent. So this is a yearly thing that we have to go through in order to continue getting funding.
Yeah. They'll even check too for our checks and balances, just like they do for the whole county one. They'll make sure that, there's, before a grant was submitted, did somebody else review that? Like those expenses, how were those approved before they even got there? So they do go through everything with a really fine tooth comb.
If there was a bid process required, so like Evan, anything over $5,000 has to go in the newspaper it might be a different number now. It used to be 5,000, but it went up. But so is it still 5? Some are 25 now in construction and.
So just 5 to 25 is a simple
Is that
request for proposal, and you can award to whoever you're not low bidder, not low bidder. Anything over 25,000 has to be bid and awarded to the low bidder, low responsible bidder.
Yeah. So for example, like they're doing fence work through the land conservation grant. They go through a process where they put it in the paper that somebody puts a bid, they choose a bid. So that's what the auditors check. Did you put the newspaper ad out? Did you, open the bids properly? Did you assign the bids properly? Anything over $15,000 has to go on their deed. There's a whole bunch of, we get checked. So if there's any concern from the public, we get checked every year on this stuff.
Well, it just goes to show that there's a lot of transparency out there. And, we are, and we say that all the time, we are driven by state statutes and policies. So that's the way it goes.
Do we get reimbursed for the audit?
We do not. That's just
No.
our yearly cost.
But
Yearly
it's
cost.
statutory required, right?
Yeah. In order to receive the funding.
Okay, if there are no other questions, thank you, Carrie.
Thank you.
Sure. And let's move on to our director. If you-
I just wanted to ask if you guys thought that we needed to have another orientation, because every year we do that orientation for board members. And it's a lot of work, so I know that, but we could open it up to the full board if anybody's interested. I guess I wanted to know what your thoughts were, if we should.
I think you should put it out there and see what the response is.
Okay.
It's a good program. I went through it when I first started, and wouldn't hurt me to do it again, I guess.
Okay.
And I think you're right on that, Mr. Ernst. It wouldn't hurt anybody for a refresher either. So I know Mr. Ulrich is interested in an orientation. So if it's just going to be you might have to maybe deal with him on that one or something. But I still have the book with all the acronyms and still look at them.
Okay.
So
I'll get a date in June and send it.
I gave up on trying to keep up with that.
Right.
And then the other update with personnel is we had interviews for our ADRC positions. So we'll be making a decision on that this week. Otherwise, everything is going pretty well.
It's a busy place, that's for sure. All right, before we close out the meeting here, I'd like to turn the attention over to Miss Ocker over here. Susie, this is your last meeting. We really appreciate you being here. I don't know if people realize that part of being this board is that we have a representative. It's required by statute that we have a representative for the public health sector of the county. And so Susie has been here since 2018, 17. Nice guess. Any words that you'd like to leave with?
No, you guys do a great job. I was glad to be a part of it. Public health to me is huge. Vaccinations and healthy communities. And then there's so much more behind the scenes that people don't realize. So I just appreciate doing this for this long. And yeah, thanks. It's fun.
Well, enjoy your retirement. I know you have some grandbabies out there you're going to have a good time with. So we really appreciate your service to the county. Thank you.
Good.
Mr. Kopish.
I want to ask Susie a question.
Yes.
Regarding public health, and I appreciate your comment. You know, years ago we had a separate health department and we combined it. From your perspective, as long as you've been on the board, how do you feel we're doing in public health? We're getting better, staying the same? What do you see?
Well, I think public health has definitely grown with what we're doing. I mean, we all went through COVID. I think that taught public health was able to teach the community a lot. I think people just take it for granted. You know, they're always there. They do it. I think those big outbreaks, those big pandemics, which no one was ever going to see, I think that was huge for the community to see. And public health, of course, was right there doing everything they needed to do and being that strength that people needed. So, I mean, I think, and with Tiffany taking over for Michelle, I mean, it's just growing. I mean, I think they're doing great. So
Yeah.
I think they're on the right path.
Yeah, I felt we did a good job during the pandemic. I don't know what the public thinks, but I know we worked on it internally very diligently. We were meeting weekly and assessing where we're at and all that kind of stuff. And I thought we did good. We didn't arbitrarily close people down like people worried about and stuff like that. And I thought it worked well. So is that your perspective?
It is, yeah. And in the beginning, you had to shut things down. I mean, things had to stop so we could rebuild and figure out what this is, what was working, and how we could continue. So although people get mad about many things, and they have different thoughts, but you have to go by what you know is the structure of moving forward. And public health did that, and we came out on top.
Yeah, it was pretty much a divisive time at that time, but you all came out of it with your heads held high and did your job. And we appreciated all that. So once again, thank you very much, Susie. We hope to see you around, just hanging out and having a good time. Sally.
What I'd like to
Use a microphone, please. I know. You thought you'd get past me. Turn screen. There you go.
No, I was just on the news in the last couple of weeks has been about polio. And I remember saying to this group here that I wish to get out a shot when I was a junior in high school. And we all got just lined up and had our shots. And now they're showing it on TV how they did that before the sugar cubes came out. The sugar cube came out later, 3 years later, because my husband got it then because he was 3 years older than I was. And he never was in high school at the time we all got shots. So sometimes my brain does work and we all have to remember we learned at that time to get shots for polio. And we had to learn with COVID also.
Yep.
I know people, it was, come on. It was something to see that they were showing it.
Yeah.
How they lined up, and that's what we did too. Old home equity, there was just a line up there with different doctors giving it a shot. And we believe in it. It's good.
Well, thank you, Sally. Any other?
People that were older than I and got polio from they had polio and now they're reflexes.
My brother was born a couple of years older than I am before, yeah, and he contracted polio, and I was able to have the shots when I was first born. So it wasn't so, yeah. Yeah. So it's just a.
We should all say, okay.
Mhm.
Ahead of the time.
Yep, it's good. Well, thank you for that input. Any other comments? All right, if hearing none and without any discussion, meeting is adjourned, and we will see you on June 10th. Thank you. Thank you all.